Welcome back. Continuing the news. In this evening's health report, Shamela Pullen looks at laparoscopic surgery.
Laparoscopic surgery, also known as keyhole surgery, is a modern medical technique that involves using small instruments and a camera to look inside a person's abdomen. This minimally invasive approach allows surgeons to perform traditional surgeries and procedures through tiny incisions.
There are many advantages: less pain. Patients who have laparoscopic surgery, your gallbladder, your appendix, they're often sent home the same day, whereas patients who have that open surgery, because of the pain control and damage and handling of the bowel, usually they'd have to be in hospital for a time. So there is earlier return to work, less of metabolic insult to the patient, less forming of adhesions. It's not uncommon for patients who've had previous laparoscopic surgery and you go back in and it looks almost like no surgery was done before.
It also helps alleviate the issue of overcrowding in public health facilities. However, there are also some disadvantages to consider.
There are two main disadvantages. One, laparoscopic surgery uses more technology, and the technology tends to be expensive. So more often than not, doing the laparoscopic procedure may be a little more expensive than doing the corresponding open procedure. The second main disadvantage is not as many surgeons may be trained in the laparoscopic approach, and sometimes because we are operating remotely from where the patient is, it can often be more difficult to learn the laparoscopic technique.
Dr. Simpson says Jamaica has made significant strides in laparoscopic surgery since its introduction nearly 20 years ago.
We are trying hard to, even for the next 5 years, to expand laparoscopic surgery even further. We've had training courses at the university geared towards the surgeons to improve the outcome. Also at KPH, we're trying to do more in terms of training. We're trying to get our own dedicated space where surgeons can train. And I know the Association of Surgeons in Jamaica have also put on courses, and they continue to do that to increase the exposure of all our surgeons to laparoscopic surgery.
With your health report, I'm Shamela Pullen, wishing you good health.